It comes out of nowhere.
It takes over your life.
The whole family is affected.
When you're very young, it can affect you.
Most will die before the age of 5.
It can affect people between ages 3 to 16.
It can affect your childhood, your school, and your friendship.
It can catch up with you when your life is in full swing, when you least expect it, and over the course of a decade or more, your life is flipped upside down.
Eventually you are left bedridden, and in most cases your life ends before it actually begins.
MLD, otherwise known as Metachromatic Leukodystrophy, is a rare recessive genetic disorder caused by an enzyme deficiency, which prevents the nervous system from functioning.
MLD has devastating effects on the patient, such as personality changes, paralysis, loss of speech, inability to eat, dementia, incontinence, seizures, and blindness.
1 in 100 people are carriers. There is currently no cure.
This is the reality of MLD.
This is my Uncle Scott. He is the longest known survivor of MLD.
Oh, thank you.
Oh, yay!
Yeah.
Ah!
Did you go to university?
I did.
You did?
Bristol.
Bristol?
Yeah. It was in Bristol.
Was it? Wow.
Hi, my name's Vivian Clark. I'm chair of the MLD Support Association UK. We set out with 3 aims. 1 was obviously to support families, 2 was to raise funds for research, and 3 was dissemination of information mainly to the medical profession, because they're the ones who are lacking the understanding of the disease, despite it being a leukodystrophy, which they should understand. They just seem to have absolutely no knowledge at all. So that was the reason for setting it up.
Yeah? You answered the door to me today.
I did answer
you
the
did.
door to you.
Oh, thank
happy.
you. Yes, I am happy.
Right, Scott was diagnosed with adult onset metachromatic leukodystrophy, MLD, in August of 1995. However, 2 years prior to that, he suddenly started failing at university. He wasn't doing as well as he should have. There were lots of concerns. He started manifesting really personality changes. This is where it gets difficult for a diagnosis, because it's frequently put down to schizophrenia, which often manifests at the age of early 20s. So the diagnosis took 2 years, and if the bone marrow transplant had happened within 6 months, Scott would probably be leading a normal, independent life with support.
Are you really smart?
I was smart.
You're smart?
Yeah.
You're still smart, aren't
I
you?
love you. Yay!
So how it affects the family? Totally. There's no part of your life it doesn't touch. The devastation of the future that's lost. Everything. There's nobody can really explain how awful it is for all the families. It's just dreadful.
Well, the treatment, first of all, was to find a bone marrow donor, and luckily I did obviously the blood test, and we were an absolutely perfect match, which is quite unusual because we're not twins or anything, but it was a really good match, and obviously there was no question that I wouldn't be a donor.
Yeah? What have you been doing today?
Nothing.
Nothing? What have you been
Music.
Music.
That was music.
Yeah.
Once.
You've been listening to music?
Yeah, been playing it too.
You've been playing it?
Playing music.
What music?
Nobody knows.
Nobody knows?
No one can know.
No one can know, can they not? Do you like the top 40?
I do, yes.
Top 40 music?
Top 60.
Top 60!
It was good to do. It felt good to give something back, but yeah, and obviously the outcome is good. But obviously his life is very different to what it was.
There are so many other untold stories of the suffering of MLD patients and their families.
But there is hope.
You have the opportunity to help aid the MLD support. All of the money raised goes towards
the life-changing research into treatment for MLD and the support for the patients and families to improve their quality of life as they learn to live with MLD.
You can help by visiting the MLD website, liking and sharing our Facebook page, and donating to our Just Giving site.
They don't have to suffer alone.